The 1960s and 70s were challenging times in America. In San Diego, the small community of San Ysidro was facing its own struggles. There was a great need for medical services. At the time, there was only one part-time doctor for 7,000 residents near the border. Family physicians, dentists, and pediatricians were greatly needed. But help was coming to San Ysidro. It would come through an unlikely source. A group of 7 mothers, or El Club de las Madres, would bring about change to their community. Lupita Cázares led the group of women 40 years ago.
Nos costaron lágrimas. Esa clínica nos costaron de lágrimas, pleitos. Había dos grupos que nos querían quitar, que no servíamos para nada, nos dijeron.
Because the need was so great, 85-year-old Carmen Martinez also became part of the group of empowered women.
Lo que me motivaba a mí era San Isidro, de ver muchas necesidades aquí en este pueblo, pues puros ranchos aquí, sin casas, y eso es lo que nos motivaba a mucha gente.
With limited English skills and education, the women would seek the help from Dr. Ruth Cavell at UCSD School of Medicine.
In the 60s, there was essentially no health services in San Ysidro. There was one physician who came in part-time into town, so there was really a huge need there, and San Ysidro was really being neglected.
Every element was critical, and the women's work would pay off by establishing the San Ysidro Health Center in this 2-bedroom casita in 1969. Faustina Solis would become a key player in the health center's early years. Most of her prior experience was working with the Bracero program. Solis brought health services to thousands of migrant farm workers in the Central Valley during the 1960s before coming to San Diego.
I don't care how hot it got. I really enjoyed the work in the rural areas. There was so much to do, and you could do so much for so little.
She would then bring her skills to San Ysidro.
But this is a very good example of how housewives, Mexican women who had, some of them, very limited education, had a great deal of fervor and commitment to serve their community.
I do recommend that you come back in about a month to get your blood drawn, just to make sure that the medication isn't affecting your liver.
Dr. Raul Trejo was a young patient getting his immunization shots at the health center. Trejo would make it a personal mission to graduate from Harvard Medical School. He would return to his community and the San Ysidro Health Center as a family physician.
I've seen it. Since I was a child, I've really seen the clinic grow and develop, and I hope it continues to do so. Thank you. Thank you for the great opportunities and for the great service they've provided for the community.
The San Ysidro Health Center has grown through the years. It recently held a ribbon-cutting ceremony for its new building, the Maternal and Child Health Center. It is a state-of-the-art facility and a one-stop shop where women and children can get all their medical services in one location.
What started with a vision from our founding mothers in a small 2-bedroom house is now a health center that serves the entire South Bay and Central San Diego, with almost 700 employees and 20 care centers. So we've come from a small cottage to a regional care network.
At the new building, there's medical services like OBGYN, early childhood development, pediatric dentistry, to a brand new cocina or kitchen where families learn healthy eating habits to avoid serious illnesses like diabetes, hypertension, obesity, among other diseases. These are just a few of the many medical services offered to the community throughout the region. San Ysidro Health Center Board President Macario Gutierrez has more than 30 years of service with the health center.
Bueno, pues primeramente yo le doy muchas gracias a Dios porque puso a estas señoras, a estas madres de familia en en este proyecto, ¿verdad? Que en un principio yo creo nunca en su mente pasó de que llegaría a ser lo que hoy es. Me siento muy orgulloso por ellas.
While much has been accomplished, the work is far from over. With health care reform at the forefront in Washington, community health centers like San Ysidro are strategically poised for more change in the near future.
We're quite excited about the future, basically because we've offered the building blocks of reform, and that's a conveniently located medical home, primary care doctor with high quality, very cost effective.
What started out as a vision and a grassroots movement for the founding mothers has turned into a spirit of empowerment for the entire community that is still visible today.
Como esto fue un sueño que se hizo realidad en la clínica, yo me siento muy orgullosa. Nomás de ver ese edificio, de que fue tan chiquito, esa es la cosa que nosotros debemos de ver, que por algo se empieza, señora.
Pues me da mucho gusto. Digo, no lo puedo creer. Como dice el dicho, sí se puede. Sí se puede. Nunca pensamos que iba a llegar a esa magnitud tan bonita.
I think the founding mothers, as well as the community itself, should take great pride, because this really was a grassroots development. It was not a top-down development, it was grassroots. And without these people becoming activists and somehow they're empowering themselves, none of this would have happened.